Take a look in your medicine cabinet, or maybe at your parents' house. Which blood pressure medication is sitting on the shelf right now? Tens of millions of people swallow one of these daily to treat high blood pressure. But most of us treat that little white tablet like a magic catch-all eraser for hypertension, with almost no idea what the chemical compound inside actually is. That blind spot creates a surprisingly common and incredibly risky habit, assuming all blood pressure prescriptions do the exact same thing, and casually borrowing a pill from a spouse or a neighbor when a refill runs late. High blood pressure is a mechanical symptom, not a single uniform disease. In one person, the pressure spikes because the heart is pumping too forcefully. In another, the blood vessels have physically clamped shut. To navigate the hundreds of different drugs required to treat these specific mechanical failures, medical students and doctors rely on a simple mnemonic, the ABCD rule. Learning this four-letter code turns that long, unpronounceable scientific name on your pharmacy bottle into a precise, readable instruction manual for what the drug is actually doing to your plumbing. The letter A stands for ACE inhibitors and ARBs. You can spot these in your cabinet by checking the end of the drug's name. If the word ends in pril, like ramipril, or sartan, like telmisartan, you are holding an A drug. Kidneys release hormones that tell blood vessels to tighten. An A drug intercepts these signals, forcing vessels to relax. This acts as a protective shield for the kidneys, making it the preferred choice for diabetics and kidney disease patients. But that chemical blockade can cause a distinct side effect. Patients taking an ACE inhibitor often develop a persistent, dry, hacking cough that won't go away with standard cough syrup. The letter B stands for beta blockers. The code suffix here is lol. If you see metoprolol or atenolol on the label, you're dealing with a B drug. Beta blockers completely ignore the pipes and target the pump itself. They throttle down the heart rate and reduce the sheer mechanical force of every single heartbeat. Easing that workload makes the LOLs highly effective for patients who have survived a heart attack, are managing heart failure, or dealing with severe anxiety. But shutting down these specific beta receptors naturally restricts the airways. For an asthma patient, taking this drug can trigger a severe, life-threatening asthma attack. You can see the contrast. One pill edits chemical signals in the kidneys to ease the pressure, while the other physically dials down the speed of the engine. The letter C stands for calcium channel blockers. The telltale suffix on your bottle here is dipene, as in amlodipine. For a blood vessel muscle to contract, it requires calcium. A C drug physically blocks calcium particles from entering the blood vessel walls, which forces those muscles to widen and relax. This direct relaxation of stiff blood vessels makes dipenes highly effective for elderly patients, particularly those dealing with isolated systolic hypertension. Because the vessels expand so effectively, fluid can easily pool at the lowest point of gravity. This frequently leaves patients with swollen ankles, a condition known as pedal edema. The letter D stands for diuretics. Patients usually just call these water pills, and the labels will read hydrochlorothiazide, furosemide, or spironolactone. Diuretics force the kidneys to extract extra salt and water from your blood and flush it out through urine. By draining the liquid, you lower the overall volume of fluid pushing against the pipes. Removing that excess liquid is critical for heart failure patients who are struggling with heavy fluid overload and severe bodily swelling. C and D tackle the hypertension entirely through basic plumbing physics. To drop the pressure in a closed system, you either widen the pipes to make more room, or you drain the fluid out. To effectively treat high blood pressure, a physician looks at this dashboard and decides exactly how to tune the engine. They have to calculate whether to slow the pump with a B, widen the pipes with a C, reduce the fluid with a D, or block the hormones with an A. When you view your circulatory system as a machine requiring specific mechanical adjustments, the habit of borrowing a neighbor's medication becomes obviously dangerous. An asthmatic trying to lower their pressure with their spouse's LOL pill could face a life-threatening airway emergency. Meanwhile, a diabetic passing up their own sartan loses the vital kidney defense they actually need. The next time you pick up a prescription for high blood pressure, look past the confusing scientific name. Search the label for the suffix, apply the ABCD rule, and identify exactly what variable is being tuned. True health literacy means understanding exactly how your body is being healed. You decode the medicine instead of just